I don't know to what extent it's impossible to help people if we haven't been through it, but I see that it's very difficult to understand what it's like if we haven't experienced it. And we sometimes hear things there are two sides to every story, that maybe we're over exaggerating, which doesn't really seem to apply in the same way when we're dealing with an unhealthy person, mentally unwell person, or a toxic person. I guess you've seen that also.
Yeah, 100%. I totally understand what you're saying. And I think clients also understand what you're saying because, there's no way that you can learn in a classroom or on an internet course what it feels like and what the experience is to have your significant other actually paint you as a person that is not you. How are you meant to learn about that in theory? It's only if you've been standing there and someone has put this identity onto you, can you actually understand what that feels like and what's going on. And that's actually something that I get that's quite common. And I'm sure you get the same thing where people have been to different, maybe psychiatrists and psychotherapists, and they come and they say, I just feel like that you actually understand exactly what I'm dealing with on a daily basis. And, that's not taking away from psychiatry or psychology, but it does give an extra depth of empathy and understanding to actually have had that experience and to know what that is like to actually to try and deal with those very confusing and difficult situations.
Yes, absolutely. It reminds me of something we experience quite often that I think is really deeply ingrained into us is the feeling of unfairness. When someone says something about us that feels really unfair, especially sometimes some of us will think, well, maybe there's an element of truth. Maybe they're seeing something that I'm missing. And I see that often with people, when people throw insulting labels onto others, it can be very difficult to defend ourselves. And we can sometimes be seeing the element of truth. So one way I like to visualize this, that people tend to find helpful, that I find helpful, is to simply say, with any of these epithets and labels, we tend to think of it as being either 0 or 1, binary. So you are or you're not. Are you selfish? Are you not selfish? For instance, are you being aggressive or not aggressive? And one of the issues with this is if we're anywhere above 0, then it's true, we are. We're being it a bit. But we don't differentiate between being it at 1 out of 10 and 10 out of 10. So I think this is really important to start thinking, I might be getting defensive, but how defensive am I getting? And of course, it can be your point of view where you might say, well, Fred, you're getting to be an 8. And I've got the impression I'm being a 4. Nonetheless, this means that I'm not being a 10. And this helps reduce, I think, a bit of the impact of the label that people throw onto us. Because otherwise you run the risk of thinking, I'm a 1 and that's it. And if we're labeled and tarred as being this, being a defensive, aggressive, selfish person, that really hurts our self-image. When I think the reality is simply much more nuanced. And I see this often with people who are concerned about being selfish. They say, I don't want to be a selfish person. But what they mean is, I don't want to be at 10 out of 10. But they think then the alternative is being at 0. But being at 0 isn't healthy. And if we look simply at a bell curve distribution, let's make this 0, let's make this 10, and 5 is in the middle. Being at one extreme isn't healthy. Being at the other extreme isn't healthy either. We need to find some level of balance where, yes, we are being selfish, but we're not only being selfish. And being too selfless means we neglect ourselves, and that doesn't help either. What do you think of this?
Yeah, that's a very good point. That is a very good point. And I think it's very helpful technique to use, especially when you're receiving the same messages more or less on a regular basis, on a daily basis, because it does like the repetitiveness does, so to speak, like brainwash. It does, when someone's saying the same things and projecting the same things day in, day out, eventually it becomes very difficult to block and to not actually start believe that. So having acceptance in yourself that you're somewhere in that range certainly helps the person to just say, I'm a 10 out of 10. I'm all of these things. I'm going to take on this repeating message that keeps getting thrown at me. Maybe it is me. Maybe I am a horrible person. Maybe I am selfish and abusive, and the messages that the abusive person will actually repeat until they get the response that they need. So I think that's a fantastic way of looking at it with that bell curve, and not being a 10 out of 10, not being a 0, to being in the healthy, which is somewhere in the middle.